this video, let us look at eclampsia. So this video assumes that you have watched pre-eclampsia all videos. So basically, eclampsia means hypertension with proteinuria. So this will lead to seizures, and this is called as eclampsia. So what is eclampsia? Pre-eclampsia, when complicated with grand mal seizures, is called as eclampsia. So this person has what? This much you have understood, that this person will be having hypertension. Along with this person had proteinuria. So she has now, this is what is pre-eclampsia. To this pre-eclampsia, you are adding this component of seizures. Now it became what? Eclampsia. Okay, eclampsia is seizures. The seizures part will bring this eclampsia. So pre-eclampsia can lead to eclampsia. Now, why does eclampsia happen? You know that she has hypertension, proteinuria. So this proteinuria and all will lead to edema. So if there is cerebral edema and all, there can be cerebral irritation. So what will happen if there is irritation of they will have seizures, right? So cerebral irritation can happen because of anoxia, because of spasm of vasospasm. The blood is not reaching correctly to the brain. So anoxia can result in convulsions, cerebral edema, dysrhythmia. That is, because of all this only, there is some irregular rhythm, right? So that can lead to convulsions. So one thing they're telling you specifically is the glutamate would have increased. This is an excitatory neurotransmitter. So the excitation of the brain is increasing glutamate. So there is actually anoxia and dysrhythmia, but what is more? The neurotransmitter, excitatory neurotransmitter is more, okay? So mostly when will this happen? Before the delivery of the baby, that can happen, or during the delivery of the baby it can happen, but antepartum is more dangerous, they are saying. So basically there are 4 stages they are saying here. Premonitory stage, that is the patient can become unconscious, there can be twitching of muscles, eyeball rolling to one side. Basically this is kind of scary, right? Eyeballs rolled or turned to one side and become fixed, and this is only for 30 seconds. But then tonic stage, clonic stage. So there's whole body will go into tonic spasm, right? The limbs are flexed and hands are clenched. Okay. What is this trunk opistotonus? It will like the trunk, head, everything will go backward kind of a thing. Okay. Limbs are flexed and hands are clenched. Respiration will cease and tongue will protrude between the teeth. Cyanosis appears. This person will look a little blue because respiration has stopped, right? Eyeballs become fixed, and this is about 30 seconds. Now let's go to clonic stage. Clonic stage, voluntary muscles will go into contraction and relaxation. It will start at the face, the twitching, and then one side of extremities, and then whole body is involved. This is the clonic stage, is where the tongue bite occurs. Breathing is stertorous and blood-stained frothy secretions fill the mouth. Blood-stained frothy secretions fill the mouth. From where is the blood coming? Cyanosis gradually disappears. This is the longest one, 1 to 4 minutes the stages, clonic stage. Here they've shown a piece of the tongue hanging out. She's bitten on her tongue. This is because of eclamptic convulsion. This happens in the clonic stage of the eclampsia. Then comes stage of coma, guys. In this, what will happen? The patient will go into coma. It may last for a brief period, or other deep comas can happen, okay? So basically, if this kind of seizures occur in succession, it is called a status eclampticus, okay? What are the differentials of eclampsia? If you see a seizure, what could it be? It could be meningitis, it could be poisoning, it could be encephalitis, right? It could be epilepsy. Maybe she's a patient of epilepsy. Maybe she has some cerebral malaria. Maybe she's having some hysteria, some psychiatry issues. Maybe she has some puerperal cerebral thrombosis, that is after the childbirth, some thrombosis. Intracranial tumor maybe she has. So basically there could be a lot of other causes of seizures which you will have to rule out, okay? So what are the complications of eclampsia? She can die also because of renal failure or cardiac failure or cardiopulmonary arrest, acute respiratory distress syndrome, embolism. All these are things that can kill the person also. Be very careful. So causes of maternal death: cardiac failure, pulmonary edema, aspiration, cerebral hemorrhage, acute renal failure, cardiopulmonary arrest, acute respiratory distress syndrome, pulmonary embolism, postpartum shock, sepsis, etc. Okay? And especially if it is antepartum eclampsia, that is before the labor, then the complications are higher. What happens to the fetus? Fetus perinatal mortality is high. You have already seen in pre-eclampsia video. The baby can be delivered prematurely, or it can have some intrauterine asphyxia, intrauterine growth restriction, right? Then it can also undergo trauma because of operative delivery, where you'll be using forceps or ventos, right? How will you manage the patient? Airway, breathing, circulation. You will administer oxygen. Then you will arrest convulsions. So how? By giving magnesium sulfate, because that's the drug of choice, right? Then prevention of injury, you should make sure that she doesn't bite her tongue, etc. You will put her in left lateral position, remember. One thing is, it will also not compress the IVC, and also she will not aspirate, right? In this prevention of injury, you can also add mouth gag so that she doesn't bite her tongue, okay, mouth gag. Then you will try to deliver as soon as possible, because pregnancy is the one that has induced the hypertension and all this. So you will have to give steroids so that the fetus achieves lung maturity if it is not mature yet, okay. Same thing they have written here. You will monitor everything, airway, breathing, circulation, etc. For control of hypertension, give levodopa, hydralazine, etc. Then you will have oropharyngeal suction so that she doesn't aspirate. So you can maintain the airway. So basically magnesium sulfate is the drug of choice. Remember the Pritchard regimen. Loading dose is 4 gram IV, okay, of magnesium sulfate. And then you will give deep IM 5 gram for each buttock. So totally 14 gram is the loading dose. Maintenance dose is 5 gram alternatively in each buttock you will give, okay, IM again. Then what else? Magnesium sulfate can lead to toxicity, so you should check for loss of deep tendon reflex, decreased respiratory rate, decreased urine output, if there is chest pain, heart block. So these are the magnesium toxicity signs. So to manage the magnesium toxicity, you will have to give, you'll stop magnesium and then you will give calcium gluconate 10 ml, okay, IV. There are a lot of other regimens for managing the seizures, etc. Diazepam, phenytoin, etc. If they ask you why will you choose magnesium sulfate, because it has benefits that it controls the fits effectively without depression effect to the mother or the infant. Okay, it just controls the fits. That's all it will do. It is not going to impair anything else. Okay, then it will reduce the risk of recurrent convulsions. So recurrent convulsions risk is reduced. Then it will significantly reduce maternal death. So maternal death, they have seen that is very less when you give magnesium sulfate, and even the baby's death is less when you give magnesium sulfate. So if they ask you why you're choosing magnesium sulfate over other drugs, you will say that safer for mother, safer for baby, and it only controls fits and it won't depress anything else in the mother or the baby, and then it will reduce the chance of recurrence. Okay. If it is status eclampticus, you'll have to give thiopentone. This is actually done by an anesthetist. Okay, thiopentone and all, thiopentone sodium is all anesthesia, right? General anesthetic. So you will have to give intubate this person, etc. for airway. Look at the management of eclampsia, guys. So what they're saying, this is eclampsia. So that means the patient already has seizures, right? So that is why you're going to manage. How will you manage? So let's look at this. This is management. So give us a green. So basically, initially you want to resolve the seizures. Then now the patient is stable, they are saying. So now what you'll do, obstetric management. If the patient is not in labor or in labor, if they are in labor already, which is majority of the case, you will make sure that you will deliver. Okay. So this is oxytocin, this is induction. You will use basically forceps or ventos so that you can cut short the second stage of labor and you can deliver the baby. Okay. This is vaginal delivery. The other option they have is cesarean section. Okay. But after this also it doesn't end. What you should do, you should keep monitoring the patient, isn't it? Neonatal resuscitation, continue magnesium sulfate, right? So basically everybody should be present and support the mother and the baby, not just deliver and leave. Okay, now coming to the case where she's not in labor. If she's not in labor, okay, but the fits is controlled, then what you will do? If it is preterm, then what you can do, you can give steroid therapy and then deliver. They're always thinking about delivery only. They want to deliver. Steroid therapy, deliver. If it is term, deliver. If the baby is dead, okay, then you will deliver again. But now if the fits are not controlled, what will you do if the fits are not controlled? You have to deliver again, right? So, if the fits are not controlled, you can think of cesarean immediately, right? And non-reassuring fetal status, again, cesarean. They're talking about cesarean here, okay? What you see ultimately is everywhere it says delivery, 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 delivery. Once she's in eclampsia, there is nothing like send her home. See, there is nothing here like send her home. Because in preeclampsia, there was one step which said that if she's fine and it's not term, you can still send her home. But in eclampsia, there is no sending home business, looks like. Okay. So this is what the textbook says. Deliver, deliver, deliver for eclampsia.